Hello everyone, my name is Kyle Wheeler and I will be teaching you today about ACL tears and their recoveries. So, first things first, what is an ACL tear? So, the very first thing is, this is your ACL, it's your anterior cruciate ligament. What it does is, it protects all the other ligaments in your knee and as well as the muscles. It protects your knee from doing any sort of anterior motions. So, the job of the ACL is to stop anterior translations of the knee joint. So, like I was saying, those anterior motions, this would be the front of your knee, and this would be the back. So the anterior motion is when your femur, this one here, and your tibia goes anteriorly of your femur, which can cause damage to the cartilage and the muscles around your knee. So, the supporting knee structures of the knee is your PCL, MCL, LCL, and ACL. Your ACL is the anterior cruciate ligament, which protects you from anterior translation. Your PCL is your posterior cruciate ligament, which protects you from posterior movement of your knee. Your MCL is your medial cruciate ligament, which protects you from medial movements of your knee. And your LCL is your lateral cruciate ligament, which protects you from lateral movements of your knee. Then you have your medial and lateral meniscus. Your meniscus protect your cartilage of your knee and acting like a cushion. So, the importance of the ACL is that it prevents tearing of other ligaments, as well as it provides strength and stability to the rest of your knee in order to do any sort of functional movements or strength building. So, the way the injury happens is you have a plant, twist, and pop. So, the plant being when you place your tibia and your foot on the ground, say you're going to the left. You'd place your foot and all your motion is going left, but you decide to then cut to the right. You will put all the motion in your femur to the right while your foot is still planted, and it puts your ACL on like tension, and it'll snap. So the at-risk population is going to be any athletes, but most specifically is females. They're 3 times higher of a risk. That is due to, they don't exactly know why, but it can be what they're expecting is that it's the way that your hips are wider. It has something to do with the angle on your knee. So other potential injuries that can happen during a tear of an ACL is you can tear either your medial or lateral meniscus, you can tear your PCL, your MCL, or your LCL. So the injuries from using an injured knee, so if you have a torn ACL and you try to walk around, play off like nothing's wrong, you can irritate your ankles, your knees, and your hips. And you can also cause damage to those where you can tear other ligaments. So the steps to recovery for a ACL tear, you're going to have, in order to get diagnosed, you're going to have to do an MRI, a CT scan, and or either one of the two. So there's 3 different types of surgeries, bone, tendon, bone, cadaver, and hamstring. We'll go into those a little bit later. So the rehab normally takes anywhere between 6 to 12 months. So the types of surgery, you're going to have your bone, tendon, bone, so that's the strongest type. That's going to take a piece of your ligament from your patellar tendon, which is right below your kneecap, connecting to your shin. Your autograft, that is a bone, tendon, bone, or a hamstring graft. All that autograft means is that it is it's coming from your own body and being put back into your own body. So those are typically the stronger of the 3. You have a hamstring graft, which is going to have a longer recovery time, but it's going to be a little bit stronger overall. It's going to last longer. So that's just going to come from your hamstring on the back of your leg. The cadaver is also the weakest one. It's when you take an ACL from a dead person and you put it into the patient. It takes the longest time to recover. So week 0 is going to be your preoperative appointments, such as learning to use crutches, and making sure you're generally well for surgery. Then you're also going to join any studies to help others learn and recover faster from ACL tears. So week 1 through 6, it's generally range of motion. You're going to be locked down pretty tight. You're going to have, your knee's going to be locked out to 0 degrees using a brace. You're going to have crutches. You're going to have no body weight going through that leg for generally the first 6 weeks. So week 7 to 12, you're going to lose that locked out brace, which is going to lock you out in a straight leg. You're You're going to go to one that locks more at like 45, and then they're going to unlock it as you progress, depending on the patient. It changes with each patient. You're going to lose your crutches, unless you're just generally doing bad, then you'll keep one crutch and lose the other. You're going to also begin basic strengthening, such as calf raises and body weight squats, lunging, that sort of thing. So week 13 to 18, you're going to do functional training, such as even more squats, more lunges, and you're going to start doing a little bit of like warm-up activities for, if you think of soccer. You're also going to start seeing swelling to reduce, and you're going to be able to see your kneecap again. But that can take anywhere to 6 months as well. So month 4 to 6, you're going to start running. What I have pictured here is an Alter-G treadmill, so that's kind of what we use in our clinic. Reduces the body weight that goes through your knee by filling up with air, kind of like a bubble, and it reduces the amount of friction that goes onto your knee. You're also going to start doing weighted exercises. So you're going to weight down squats, you're going to do weighted lunges and stuff like that. Month 7 to 8, you're going to start doing jumping and cutting motions. So the jumping, you're going to use boxes like this to progressively get higher and higher on your jumps until you're back to normal. Your cutting motions, you're going to be doing a lot of like stopping and going through running. So you're going to be going full speed, stop, turn the other way as fast as you can, that sort of thing. So month 8 to 12, you're only going to do that if it's needed. Generally, you'll be cleared by like month 9, but month 8 to 12 is if you're kind of taking a little bit longer to recover. Does anyone have any questions? Yes.
I do. So let's say you move to, I think it was month 7 and 8, and you have to do the box jumps. What happens if you jump and then re-injure yourself? Would you have to start over again?
So yeah, you would have to go back through and get surgery again. The chances of you doing that is very, very slim because you get started off in a really small box, like 2 inches tall.
2 inches.
So, and they make sure they won't progress you unless you're ready. So the 6 to 7 month mark that you would do that at is generally when you'll get there. But again, it's patient dependent. It can happen longer down the road depending on how you're doing.
Okay. And you guys follow the Rice model? Or?
Yes.
Okay.
Yeah.
Gotcha.
Any other questions? No? All right. So this is my works cited page. Have a great day.